from Wish TV and Community Health Network, this is a Health Spotlight Town Hall Special.
Good evening to you and welcome to this Wish TV Health Spotlight Special. For the past 2 years, we've been very proud to team up with our partners at Community Health to dedicate time to talk about the biggest health issues facing Indiana. And we've talked about COVID, mental health, maternal and infant mortality as well.
Yeah, and tonight we want to talk about the #1 cause of death in our state. And it could be a silent killer. We're talking about the heart, cardiovascular disease. We're going to show you some numbers right now from the Centers for Disease Control. We said heart disease was the #1 cause of death in Indiana in 2021. In fact, it was the leading cause of death in 42 of the 50 states. Only 13 states had a higher death rate from heart disease than Indiana. Hard to believe. In that year, on average, in Indiana, more than 40 people died every single day from heart disease.
I also want you to take a look at this map on your screen. Now that's from the CDC. It shows the death rate from heart disease in each Indiana county. Where you see the darker colors, the red and brown, those are the counties with the highest death rates from cardiovascular disease. The highest rates, Vigo, Stark, and Fayette counties. The lowest rates, Hamilton, Carroll, and Cass counties.
So we want to welcome in our first guests for tonight. Dr. Rakshita Chandrasekhar is a board-certified cardiologist for Community Health Network. Doctor, good to see you. Thank you for joining us. And Dr. Sandeep Dubey is the medical director for the Cath Labs at Community Heart and Vascular. Good to see you as well, Doctor. Thank you very much for being here. I know the weather may have caused us some problems earlier on, but things are clear. We're happy to have you here on set tonight. Lots to get to tonight. So we talked about the numbers specifically before. Eye-opening stuff, right? But let's break it down for the folks at home. We're not only talking about heart attack here, right? We're also just talking about cardiovascular disease in general. Dr. Dubey, if you could explain a little bit more for our viewers what that might be.
So cardiovascular diseases are the disease of heart and the blood vessels. So it encompasses a lot of different diseases. So obviously we are familiar with the heart attacks or what we call the ischemic heart disease. Then you can have strokes, cardiac arrhythmias, which are the irregularity of the heart. Then heart failure is a common heart disease, as well as diseases of the cardiac valve. So these are the major cardiovascular diseases.
And
a lot of them.
Absolutely,
Yeah.
so many to learn about. And Dr. Chandrasekhar, how would you answer that?
Yeah, it encompasses a lot of, in terms of cardiovascular disease, like heart is like a house, has its own plumbing system or own electrical system. So diseases that clog the arteries, causing cardiovascular disease. And as like Dr. Dubey mentioned, disease of the electrical system causing a lot of arrhythmias and heart failure. And of course the blood vessels, peripheral blood vessels as well. So it all encompasses cardiovascular diseases.
That is so interesting. It gave me a great visual. A heart is like a house. I never thought about it like that.
No doubt.
Let's go ahead and get back to those numbers now. Heart disease is the leading cause of death in Indiana, and it already kills around 15,000 people in the state each and every year. But there is also reason to believe it's going to get worse over the next 5 to 10 years. Now, my goodness, it's hard to really put that into light, if you will. You guys hear these things all the time. I think when we talk about these kind of statistics, it surprises people in many communities. Do you feel like people are educated on just things that you probably have every day?
Unfortunately not. People know about the heart attacks, but they are not so familiar with all the risk factors that go into the heart disease itself. So, there are so many things that go into heart disease. The risk factors like hypertension, diabetes, obesity, smoking, all those can affect family history, can affect the heart disease. So as we think about the heart disease, we have to think about all the risk factors that go into creating the heart disease, and then how to treat it and how to prevent it.
What is the biggest risk factor, in your opinion, doctor, out of all of those?
Well,
if you had to weigh them, if you had to say, okay, well, maybe if you had it in your family, maybe that's the #1, or is it obesity?
it's kind of hard to pinpoint because for a person, you have two types of risk factors. One is the modifiable risk factors, and the other is non-modifiable risk factors. Non-modifiable risk factors is how you're born, your genetics, your genes, that you cannot do anything yet, you cannot modify. But modifiable risk factors are like hypertension, diabetes, hyperlipidemia, that's high cholesterol. Those are, I think, and of course being overweight and obesity, those are, I think, the four main things that are like risk factors for cardiovascular disease. So it's kind of difficult to kind of pinpoint that this is number one or number two. It's kind of like a conglomeration of all these risk factors that causes this highly inflammatory state leading to cardiovascular disease.
Even being able to identify them, that's a step. You know, we're going to talk a lot tonight about numbers.
Yeah, a lot of numbers, because we got a lot to get to tonight, but it's also important to remember the patients in this discussion as well, and how knowledge and quick action can actually save lives.
Started out as a kind of an acid reflux, and then all of a sudden it just starts across my chest. I just thought, well, maybe it'll pass, and it just kept getting worse, and then it broke out into very profuse sweating.
And he said, Mayor, I think I'm having a heart attack. And I'm like, okay, called my daughter.
I knew that if my dad was willing to call 911 or go get help, that it's something serious.
All I remember is the doctor showing me the CT image of of my aorta and telling me we're going to operate immediately.
3 hours at most between the time he called me or, felt the pain and was on the hospital table. He goes into the surgery, and it's like a 9-hour surgery. They called her every 2 hours to tell us how is he doing during that surgery. And, Steffi explained to me that usually never happens.
I have worked at many hospital systems in my nursing career in various parts of Indiana, and I've never seen what community has provided my family.
After the surgery, the nurse practitioner who was in on the surgical team said that when they opened me up, they could see the blood pumping through the aorta, which means it was transparent. So if I hadn't have been on top of my blood pressure, all it would have taken is one rupture, and I'm not here anymore.
Did you forget to take a medicine, or?
Now I'm in a position where I look at what I could have lost. And that's when it hit me that I almost missed the daddy-daughter dance at my daughter's wedding.
Having him here to actually be able to do that daddy-daughter dance meant the world to me, because that's something we've looked forward to, and that's something that I will always cherish.
That was very important because she means a lot to me.
Honestly, probably last Father's Day, I was scared that I wasn't going to have him anymore and that I wasn't going to be able to celebrate a Father's Day with him anymore. But knowing that I'm going to be able to celebrate this one and many more to come means a lot to me.
I am just very, very grateful for them. And I guess the end of the story is, well, I don't know if it's the end, but she ended up working there.
How do you feel about that?
Wonderful. And they asked her, and they said, well, why did you choose community? And, because you saved my dad's life.
I didn't know much about community, and once we got sent to the Community Heart and Vascular, I walked in there, I saw the experience, I saw the care my dad got, and I was like, and I remember, and I told my mom this as we walked out while he was going to surgery, she's like, I could see myself working here. They share the same compassion and the same passion that I do about patients, that if they're willing to treat complete strangers with the utmost respect and care, and they didn't even know us, just imagine, what they're doing for everybody else. And that's the team that I wanted to be a part of.
Looking back on it, I think we're just very, very lucky that we were at the right place at the right time.
Wow.
That is eye-opening stuff, isn't it? I want to throw out what may be a couple of shocking numbers to people at home. The CDC estimates, and we just talked about this a little bit here, nearly half of all Americans have at least one of the 3 risk factors for heart disease that we just mentioned before that story. We're talking about diet with too much fat, cholesterol, and salt, not enough physical activity, tobacco use, And Indiana tends to be high on all of these categories, guys. So what is the outlook in Indiana over the next decade or two?
Yeah, so last year, there was this nice paper in American College of Cardiology from Harvard. They studied the long-term outlook until 2050, and the numbers were literally shocking. There's about 40% increase in diabetes and 30% or more increase in high blood pressure, high cholesterol, and obesity. So these are shocking numbers of the risk factors that are going to increase. And then the heart disease, the cardiovascular disease, stroke, heart attacks, and congestive heart failure all are supposed to increase 30% in the next 25 years. So these are just shocking numbers.
That's a substantial increase.
Yes.
My goodness.
Yeah.
We were kind of talking about this previously, but it seems like it just takes the smallest thing to completely change someone's situation. I mean, I feel like with cardiovascular health, that's what frightens a lot of people. They feel like they might be, on top of it, and all of a sudden their whole situation changes. Talk about the timeline with trying to just figure out what's wrong and how drastically different, the outcomes could be. Either one.
Yeah, you can go ahead if you want to.
Yeah, so the cardiovascular disease is devastating because it happens very suddenly. We saw this patient, that had a condition that we call aortic dissection, had a dissection of the big artery that comes from the heart called aorta, and things can change within a matter of minutes. Same thing happens with heart attack or strokes, that a patient, person can be completely healthy, and within a matter of minutes they can be dying.
Whoa.
Yeah.
That's scary.
Yeah.
I didn't like the numbers that Dr. Dubé put out there,
No,
doctor.
not at all.
So I don't like those at all. Is there anything we can do to change the future, to change that 30% number? I mean, is it diet? Is it exercise? I mean, obviously we need to all be doing more of that. But something's got to, because a lot of this is social, no?
Mm-hmm. Right. So yeah, like what Dr. Dubé said, there's definitely worsening numbers if we don't kind of control the risk factors, right? So before, cardiovascular disease was supposed to be the disease of old age, but I see a lot of patients who are like in their late 30s and 40s having severe coronary artery disease, going in for to get a stent, bypass, and so on. So to talk about the risk factors as such, you got to, especially in African American individuals where the incidence or prevalence of high blood pressure is extremely high, because it's thought that they may have, according to the studies, that they may have like a salt-sensitive gene that makes them more prone to have high blood pressure.
Wow.
And of course, cholesterol issues, being overweight, and plus the lifestyle right now these days, it's not conducive to cardiovascular health. Diet, of course, a lot of fast food, not enough exercise, not moving enough. These are all the risk factors that can slowly, over the course of months to years, kind of multiply, causing acute cardiovascular syndromes.
One of the key things that we continue to hear from the medical world right now is using a data-driven approach. You both just gave us so much good data, but especially when we talk about heart disease, how is it different than what's been done for the past 50 years or so?
Yeah, so there are two things. A lot of technology and medicines are now available that were not available 30 years ago for ischemic heart disease and heart attacks. One of the things is statin therapy, the cholesterol lowering drugs, and they are very effective. So they have markedly decreased incidence of coronary artery disease in patients who take them properly. There are a lot new medications for high blood pressure and diabetes. We see all these advertisements for all these drugs for diabetes. They not only help diabetes, but also help people lose weight. So there are a lot of new medications that are available. And then, we have a lot more technology. 30 years ago, stents were just coming in, now, and they were available in very select locations. Now we strive for what we call door to balloon time for 90 minutes. So when a patient hits the ER, we strive to open the artery up in 90 minutes. So you know, the cath lab team, the physician, everybody comes from their home, and they're able to open the artery up within 90 minutes. So this patient whose artery was blocked, you know, blood flow is restored. So so there's a lot of not only new medications, new technologies, and we are hoping through this show also to increase awareness.
Sure.
What you should do. Which is the key is to increase the awareness of symptoms, the treatments available, the preventive therapies, how to modify your risk factors. All those hopefully will mesh together to decrease the heart disease.
Not all doom and gloom. A little bit of promise there. Thank you so much. And there is another story inside the numbers on heart disease and its impact on women and communities of color here in Indiana. We'll talk about those and what you can do starting tonight to help improve your health next on this Community Health Spotlight.
You're watching Wish TV. We are local. Health Spotlight, presented by Community Health Network.
And welcome back to this Health Spotlight tonight as we focus on cardiovascular disease and heart health here in Indiana. We've already talked about how heart disease is the #1 cause of death in Indiana. But there's another story that we want to also hear about tonight as well.
Absolutely. Cardiovascular disease has a greater impact in communities of color. But when you start to dig deeper into the numbers, you see the disparities. I mean, just take a look at these numbers from the Indiana Department of Health. The death rate from heart disease for Black people in Indiana is 20% higher than for white people. And one other from our Health Spotlight in February. This is from hospitals in Marion County. It tracked patients in 2020 with one of the factors was your blood pressure under control. For white patients, blood pressure was high and uncontrolled for 24%. That number jumps to 32% for Black patients and 26% for Hispanic patients. So let's go ahead and welcome back our team from Community Health. We have Dr. Sandeep Dubey and also Dr. Rakshita Chandrasekhar as well.
Also joining us right now is Alilta Sawyers, a registered dietitian with Community. Alilta, I want to start with you here, okay, because we have to talk about this specific topic, Black Americans when it comes to heart disease and diabetes. There seems to be a correlation between those two, right?
Yeah.
So what can be done to fix that? Is there anything that can be done?
It's a big task, honestly, to address because there are disparities like your socioeconomic status, food deserts, right, that afflict many folks who don't have access, and you know, and then the importance of going to routine checkups isn't emphasized in our communities, and getting seen for preventative health care measures, right, that can be addressed. So when you think about those types of disparities and how they afflict the minority population, it's a big task to address. So yeah.
It's a huge task to address. I feel like we talk about it all the time in our shows. I mean, it leads us to the bigger question, right, on how our health is really impacted by social determinants. You know, where you live, if you have access to health care, access to healthy food places, to exercise. I mean, we literally in the break were just talking about cool places to go because in each community we need that. How does that play a factor?
We do need it, and it's a big disparity for some communities over others, right? But programming, outreach, tap into your healthcare facilities. Most times there are resources that are available to families and individuals who are looking for some assistance of any sorts, or just knowledge, right? Social media is great now. A lot of things are being put out there. You know, tapping in where you can, I think is probably the most important part.
So breaking a habit is not easy.
No.
And not at all, right, for anyone. So I guess this is a kind of a two-pronged question. One, how quickly can you break a habit if you're really focused when it comes to this stuff? And then two, if you do break said habit and you say, okay, I'm gonna get really good at my health, I'm gonna really focus on what I eat, how much I exercise, how quickly can you reverse the effects that maybe are impacting your heart?
That's a unique question, and it's individualized, honestly. So there's not one one answer that fits everyone's situation. That's why it's important to talk about unique strategies that impact yourself and barriers that you might be experiencing. But with dedication and some hand-holding, which most of us need, especially if we're adults and we're set in our ways, right? And some assistance, like from someone like myself, getting some guidance, some individualized, care strategies. It's very possible. It's very possible. But I think making sure that you understand what are your driving forces. And most people, when they keep that in mind, they're dedicated to stay on path.
Absolutely. Okay, so I want to talk about something that we get a chance to hear from time to time, but not often enough, and that's about women and heart attacks. Okay, so we've heard that heart attacks and symptoms of chest pain, pain shooting through the arm, but there are different signs for women. If so, what are they?
Well, kind of going back to one of the most famous physicians, Dr. William Osler. He was a Canadian physician and he was an excellent author. When you look at his literature, when you look at the books he's written, he describes a typical middle-aged male describing typical angina pectoris, chest pain, especially that comes on all of a sudden, aggravated by exertion, relieved by taking rest or medication. And this has been an age-old thing that, okay, chest pain, that's how acute coronary syndromes occur, like significant chest pain, shortness of breath, clutching of the chest, like elephant sitting on the chest. But it may not be always the same with women, We have a lot of atypical presentations, like unrelenting heartburn that does not go away with, Tums. They've tried Tums, over-the-counter medications like PPIs or proton pump inhibitors or H2 inhibitors, and jaw pain, neck pain, radiating to the back, or pain or numbness or tingling sensation radiating to the left arm. So when I talk to my patients, especially females, apart from asking, okay, do you have significant chest or any history of chest pain or chest discomfort, I also say that any chest symptoms at all, because if we ask chest pain or chest pressure, they're like, no, nothing. But if you ask anything wrong that you feel, any chest discomfort, any other sensation, then they kind of slowly open up and say, yes, we don't have actually chest pain or chest pressure, but it's more of a chest discomfort, more of a heartburn symptom that kind of does not go away. So yeah, the presentation is definitely atypical in women, and we should not be ignoring that.
How do you have those conversations with a doctor that maybe isn't recognizing them? You got to advocate for that, I would assume, right? How do you do that?
Right. So, of course, after talking to them about, risk factors, we have to kind of probe in a little more deeper. Like, for example, ask them, how far can you walk before you have to stop, saying that you're short of breath or you're having chest discomfort? Can you do 2 flights of stairs? Can you do your routine household activities without interruption? Compared to how you were like a year ago or 6 months ago, has your activities changed? So there are a lot of change in the question pattern that kind of, we can kind of get the answer rather than just like, okay, do you have chest pain or chest pressure? For most of which I have noticed that they say, no, we are good. But when you kind of probe into the finer details about their physical activity, that's when I feel that they slowly start revealing the symptoms.
Absolutely. You only have about a minute or so left, and we want to make sure that we talk about what anyone at home can do right now to start improving their health. Let's talk about Community's online health profiler.
Yeah, so, major things are, if you have any symptoms, immediately talk to your doctor, your primary care physician, or your cardiologist. Or if the symptoms are severe, you should seek attention in the ER. Things that need to be done at home, control, if you have high blood pressure, diabetes, high cholesterol, take your medications regularly. Regular exercise is very important. We advise 150 minutes of exercise every week, so that's about 30 minutes of exercise at least 5 days a week. That could be brisk walking or something equivalent, whether it's biking, Zumba, whatever you like to do. Eating healthy, make sure you have a serving of fruits and vegetables in your diet every day. Avoid red meat, eat more of the white meat or fish. Avoid smoking, and then having friends and family. Good social relationships are very important, not the virtual relationships or the media, but the actual relationships
These
are very
great
important.
things to keep in mind.
Yeah.
Yes, and we all got a little bit smarter tonight. Thank you so much for being here. We really appreciate it. Unfortunately, we're out of time. We could probably talk about this all night. We got to go. We'll see you back here tonight at 10 and 11. Thank you so much.
Thank you.